So I'm going to share my screen with you. All right, so you should all see my screen now. And I'm going to start the presentation. So first of all, I'd just like to take a moment and tell all of you just a little more about the Global Business School of Health at UCL. So we are a new school, and we are just starting this year at UCL. And it's really, many of us know that health and healthcare continue to play such a pivotal role in society. And we at UCL felt that there needed to be an MBA that didn't just have a few modules about health, but really put health into the DNA in the program. So that's what this is really about. It's about creating health leaders, health consultants, senior managers across a variety of related fields to really reimagine global healthcare. And really to be courageous leaders, people who can really unravel kind of the challenges and really make healthcare management much, much better so that we can really address the needs of society going forward. So with that, we have created a very unique MBA. This MBA Health is like no other MBA that you could possibly do to get a health specialism. It was really designed through a very co-design, co-production with not just business and management professionals, but also health professionals. So this program really blends the best of kind of the world-class academics at UCL. And of course, much of what UCL does, probably about 70% of what UCL does, is in the health and life science and medical science areas. And then we've coupled that with all the things you would expect in an MBA. So there's no shortcuts here. This is really, you get the best of a general MBA, but you also get the specialism of health. And I'm going to talk just in a minute about how we did that, because it's really important, I think, for you as prospective students to just understand what a tremendous opportunity this is and the kinds of people that you'll be interacting with and the experience that you'll have on this MBA Health. And so let me talk just about your journey. So when you come on to this MBA Health, you'll first, once you're enrolled, you'll have an opportunity first to take a number of what we call primer courses online. And these are really designed for two reasons. And that is because our MBA Health, you don't have to already have a health background. You can actually be somebody who's looking to pivot into health. So you might already be in business, you might be working, and you want to really come and get into a health MBA as a starting point in your journey and your career to move over into health, which of course, given the importance, the prominence, and the continued prominence given demographics, health change, lifestyles, it makes a lot of sense. Or you might be somebody who's already working in healthcare and you want to really move up, accelerate your career. Or you might be a consultant, a doctor who's looking to get an MBA to really improve your business and management skills. So wherever you start with, we've created a suite of what we call our online primers courses. These are, once you're admitted into the program, you'll have access to these, and we might recommend certain ones for you. So if you've been out of the education for quite a while, we might look to recommend time management, just study skills to help you get back into the rhythm of being in the classroom again. If you come from a business and management background, don't have much health background, we offer primer courses for you to really understand global health in that health context. And then, of course, for those of you who are very much in health and your career's been in health, we might recommend that you do something in global health. So that's how you start into the program. Then once you're in the program will start with a 2-week induction. And that's really an opportunity for us to get to know you, for you to get to know your colleagues, your peers, and really develop your cohort and get that cohort experience. So some of that personal development will be that you will take a number of assessments, personality assessments, and the idea is to help you really understand your journey. We also have career coaches that'll work with you to help articulate what you want out of the MBA, so that we can work with you across the year, so that when you finish the MBA, you get the kind of career boost or acceleration or pivot, whatever you might be looking for out of this particular MBA. So I'm going to talk some more in a minute just about that career aspect, because it's really important in terms of how we've designed. The other thing is we want you to learn how to be on a really diverse team, how to build high-performing teams. So part of that will be through your experiential learning opportunities on this MBA. So you'll be working, and I'll talk a little bit more in a minute about the Global Health Challenge project that you'll do as part of your MBA experience. But when we're in those first few weeks, what we'll be doing is helping to assess you, to put you into teams for your project. And that's going to be very important for you to learn how to collaborate, how to function in a very diverse team, how to lead in a very diverse team, as well as working on the project and co-designing and co-producing with others in your cohort. We also, as part of this induction in the first 2 weeks, you'll go away for a 3-day residential off campus, away from all the noise of trying to settle in, to really learn, of course, much more about yourself, much more about kind of organizational behavior, but also just to get a real nice introduction to health and healthcare management. So this is an opportunity for us as a group and you with the MBA team to really reflect and to get a starting point into your program. So that's really very important aspects of the induction and the kind of onboarding that we hope will make you feel like you belong, to find your voice, and to really settle in very quickly. Now, I want to talk just a little more about how your program is going to be structured. So we see it as kind of like short bursts. So if you think about yourself in this MBA, you're going to be running a marathon, but in there's going to be lots of sprints. So the way that we constructed the actual content, the program, are in these what we call sprints, these 30 credit modules. They're quite chunky. So when you start, we have a virtual platform, Moodle. Many of you may have studied on Moodle before. So you'll have some case studies, some videos, some readings that you'll do before you start each of your 30 credit blocks. You'll come in, the first one's called Strategy, People, and Marketing. So how does it work? They run across 4 weeks. They're a very intensive 4 weeks. The first week will be strategy. The second week, you'll focus on organizational behavior and human resource management. And the third week, you'll focus on marketing. And then the fourth week is what we call wrap-up week. So what is wrap-up week? Well, wrap-up week is where we'll bring in health experts, people who work in strategy and health, people who work in human resources in health, and people who are marketing health or healthcare, to really contextualize what you're learning within the healthcare space. This will be in addition to having done case studies on these topics in health. So the idea is to really give you all the kind of strategy, the human resource, the organizational behavior, and the marketing that you need as an MBA, but also to really put it in this context and help you see how it applies to health and healthcare. So this is a really important part about everything that we do, is making sure that we always bring it back to health and healthcare. Then you'll finish that block, and the team that will be teaching you will be a mix of business and management experts and also health experts. We'll also have some of the leading CEOs in different parts of the health and healthcare sector coming in and speaking to you and working with you and also mentoring you throughout your program. So when you finish that first block, you'll then have 2 weeks between the first block and the second block. Those 2 weeks are to get ready for your next sprint. Your next sprint is called Funding, Finance, and Regulation. Again, you'll have a week on accounting and financial records. You'll have a week on corporate finance, and you'll have a week on healthcare policies and practices, and really learn much more about the regulatory environment. And then you'll have your wrap-up week. And again, we'll bring in people from the finance world, we'll bring them from accounting, we'll bring them from boards, and they will be the people who are really working in that sector in health and healthcare, and they'll bring that to life. Then that finishes your first term on the program. You'll have your final assessments, and then you'll come back after Christmas break in January. You won't start straight away, and I'll talk to you a little bit more, because you'll have your field experience for one of your big projects, which is your Global Health Challenge. Then you come back for your next two. The next one is called data-driven management. That will have, your economics, your health economics. It will have your, really looking at data analytics in a healthcare setting. And then last but not least, we've got a week on sustainability in healthcare. Again, you'll have your wrap-up week. And then you'll have your 2 weeks to prepare for the next block. Now, the next block's a little different. It's called Contemporary Topics in Health and Healthcare. That block is really an opportunity for you to explore some very specific aspects of health and healthcare. So you'll have a choice between 5 and 6 1-week kind of themes, and you will pick 3 of those that you will do as part of that block. So you'll have some choice. There will always be contemporary topics, the latest thinking, things like health and climate change, systems thinking for healthcare, digital health. There'll be a variety, health innovation, and you'll select from these topics 3 that you'll do as that final block. And then that really brings me then, and again, you'll have your assessments, you'll be working through those, you'll have your cases, and then there are the last kind of 2 big projects, and one of them that you will start actually at the beginning of the year. So I want to talk about the projects because they're really very important for this MBA. So the first project is called the Global Health Challenge. So if you're at all familiar with UCL, you'll know that UCL has what it calls its grand challenges. These are things that are really big, as we hear today, often referred to as wicked problems that we face as a global society. And one of those grand challenges, of course, is around global health. So what we've done in this MBA is we've created a module that you'll take as part of your kind of experiential learning called the Global Health Challenge. So when you're in your induction at the beginning of your program, and I mentioned to you that you'll be put into groups, that will be the group that you will start at the beginning of your program to work on this Global Health Challenge project. So in this team, you'll also have UCL academics who are experts in the area and also the country you'll be working on. You'll have your fellow MBAs, and you'll also have some people from the industry. The team and the project is about working on a project on a health problem in a low and middle income country to find a solution to that particular health issue. So you will start at the beginning of your journey. You'll have workshops across the year. You'll be getting together with your team, with your supervisors. And in January of the year that you're doing your MBA, right after the new year, you will travel to the location of the country that you're working on the project. That will be a very intense 2 weeks that you'll spend out there. You'll do interviews, you'll be meeting with health professionals, you'll be learning about the health system. You'll also be collecting data and undertaking primary research for your project to help find the health solution you're looking for. But you'll have that opportunity to really engage firsthand with those in the country and those that you'll be working with on the project. You'll then come back and you'll continue to work across semester 2. And then in the final part of your MBA, you and your colleagues will write this up into a report. You'll also be doing a presentation. Also, part of your assessment will be what we call a 360, where you'll be evaluating your colleagues that worked on the project. They'll be evaluating you. Your supervisor will be evaluating you, and you'll be evaluating yourself. It's a real opportunity to get some hands-on experience of addressing a very significant health challenge. So this is a very important part of our MBA, is to make sure that we're maximizing at every moment your ability to actually apply what you're learning to a real world case. So that's part of your final kind of assessment on your MBA. The second big project that you'll work on is called the Health Consultant Project. Again, this is an opportunity for you to take what you're learning in your MBA and to really apply it in a very coherent way across a project. So this will be a consultant project. It's not a placement. What you will do is we are working currently with lots of consultancies, hospitals, also private hospitals, private health firms, clinics, to collect and consolidate very specific projects that our MBA students can undertake. So it would be just like you're working for a consultancy firm, and you would be given a brief and work on a project up for your client. These are real world clients you'll work with. You will work either, depending on the project, in a small group, much smaller than you work on the Global Health Challenge, or you might even be the only person working on that. We will work with you in term 2 to really define that project for you. We want to make sure that your consultancy project aligns with your ambitions. So your career coach will really, and part of visualizing and thinking about what you want out of the MBA, is to make sure that the consultancy that you work on is going to be aligned with where you want to go when you finish your MBA. So if you want to go into consultancy, we'll try to match you with a brief that does that. If you're planning to go into the charitable sector, there are NGOs, or if you're going to go into public health or work in a hospital. So that's where our career coaches who will be working with you across the year will be so integral with helping you define what kind of project you want to be working on as your health consultant project, so that you get the experiences you need and you have something that you can show your future employer or your current employer what you've done and what you've learned and achieved in your MBA. So given the intensity, this is a real face-to-face, full-on MBA. And so who are we looking for to come on to this program? First of all, we're looking for ambitious individuals who are really determined to become exceptional leaders in healthcare. This is a very ambitious program for people who really want to make a difference. As a school, that's really our ethos. Our mission is that we want to really develop. We want the future healthcare managers and leaders to have come out of our program in our school. So you may be already a manager, you might be a clinician, you might be a medical doctor, you might be a business specialist, but we're really looking for people who want to elevate their career and make a difference in health and healthcare management. You should have some experience, not necessarily in healthcare management, but at least in leadership. and you've got to be ambitious. This program is really for people who are very ambitious and who want to really move their career forward. So you do need to have some work experience, ideally at least 3 years of work experience prior to coming into this program. And the reason that's so important is it gives you some context. It helps you reflect on what you're learning and really think about how you're going to apply that. So if you're thinking about embracing top positions in healthcare and health management, and you really want to make a difference to global health outcomes, this is definitely a program for you. So let me talk now just about the admissions and the entry requirement. We're looking for people who have at least an upper second class. You have to have at least a 2.1 degree or its equivalence in an overseas qualification. We will look at graduates without relevant degree classifications, but they will need to have extensive work experience. And what do I mean by extensive work experience? They need to have been out and working at least about 15 years and really be able to demonstrate that they got that kind of exceptional ability to come onto a program like this. In terms of IELTS scores, you need to have a 6.5 or above, and no less than a 6 in any of the sub areas. As I mentioned just a minute ago, in terms of work experience, you need 3 years of post graduation. So it can't be an internship or something that you did while you were studying. This has to be work experience after you've completed your studies. And we also require you to have a balanced GMAT score or a valid GRE score. We don't have a specific score, but I would say you want to be around 600 as a minimum to apply for this program. Then we also have interviews, but the interviews are a final stage. So once you've gotten everything together and you've applied to the program, then we can look to have the interviews. So here are some top tips just for thinking about putting an application together. You need to make sure that you meet all the eligibility criteria. There's no reason to apply if you don't. I don't want to waste your time, and of course, we will have many applications. So you need to make sure that you've got the English language criteria, you've got the work experience, and you've got the degree classification. You're going to need to also submit 2 references. Ideally, one of those should be an academic reference and the other one a work reference. And if you've got any hesitations about your references, please just reach out to us and contact us, and we'll be happy to talk you through those. And again, look at our website. Make sure this is the right program for you. This is a very exceptional program. There is no other program like this on the market. So make sure that this is the program for you. Then make sure you've submitted all the documents required for your application. Unfortunately, we cannot look at your application until it's complete. So please, if you're going to apply as soon as possible, get your application in and get it complete. And then once you've met all that criteria, then we can start to book you an interview. And then also you will have a personal statement. And what we're looking for in that personal statement is to get to know you a little better. And it's the same thing with a personal interview. So be yourself, be genuine. We want to make sure that this is right for you and that you can really join and contribute to this cohort of students that will be on this program. So just think very carefully about why you want to do it and what you hope to achieve and do afterwards. I also want to mention to you that we've got a number of scholarships available and other kind of funding avenues that you might think about. We have what we call the MBA Health Future Impact Leader Scholarship. This is up to £15,000 from applicants from low and middle income countries. If you're not sure if you're from a lower middle income country, we do have a guide for you on our application, our website, that'll help you understand that. And again, please write to us if you have any hesitation. We also have a very special scholarship for women. It's called the Women Healthcare Leaders Scholarship, and it's up to £5,000. But it also includes some very special coaching and mentoring for students, for female students who want to really get into senior roles and the C-suite. So it's definitely, please apply. And then last but not least, we've got a scholarship for people who live in East London or work in East London who would like to come onto this program as part of our commitment to our local community. There are also other scholarships, and you know, there is, if you go to the UCL website and you Google scholarships, you'll find scholarship finders. But remember, you know, if you're from the United States, there's federal funding that's available that you can get a direct student loan. There are also a number of international scholarships offered through the UK and the Commonwealth that you can apply to. And also UCL has a range of graduate taught funding programs. So again, I highly recommend that you look around to see what your funding opportunities are as you put together your funding package. Now I'd like to just talk a little more about the career support, because that's really something that we have invested a lot of time and energy in. This is a program where you will feel very nurtured, very taken care of in terms of making sure that you can move on. It's important for us. It's important for our reputation that the students we take can achieve the outcomes that they want out of this program. So I've already mentioned to you that we'll have these online kind of primer courses that you can take to help prepare yourself for the program. I've mentioned to you the 2-week induction program, personal development. But what I haven't mentioned to you is that we'll have career coaches in the school who will begin working with you. We also have a deputy director of our MBA program who is a certified coach who will also be working with you. And there'll be lots of what we call enrichment activities and sessions. So across the year, we'll be having speakers in from various sectors. We'll also be having employers in to come in and talk to you, to give you tips. So that's going to be a very important part of our journey, is to make sure that you're taken care of, that your personal ambitions. If you're coming from abroad and you're looking to do post-study work, we'll work with you to help identify that as well. If you're looking to return to your home country, or if you're UK based, we'll really be working with you from the very beginning of your program. And also we have excellent career services at UCL in addition to what you'll get within the program. And that is a very, very important part of what we offer in this MBA, is to make sure that we understand your ambitions, understand why you're taking the program, understand what you want as the outcomes, and help work with you and support you to achieve those. So what can I do after I do this MBA? Well, some people may want to continue on in their own firm where they're at. Some might look to move into new sectors. This is an opportunity. You know, health consultancy is booming right now. So many organizations around the world are looking for opportunities to better their health systems. When I speak to CEOs of major hospitals and health organizations, they all recognize that although we've kind of made it through the pandemic, there is so much work, improvements, bringing in advanced technologies to sit alongside professionals to rethink systems that needs to go on in our healthcare sphere. And so health consultancy is a vibrant area that we anticipate many of our students will want to either go into or advance in. Also senior management roles, and those cross not only organizations like the NHS and BUPA and the World Health Organization, but there's new opportunities emerging every day in big pharma, biotech, and the public and private space. And they are looking desperately for people who can bring that professionalization in, really take their health organizations to the next level. And pharma, as we all know, along with health tech and med tech, in terms of startups, in terms of opportunities to really, advance strategy and product development, is a key area that we anticipate many of our students will either come from or go to when they finish this MBA. So that really is the program. Now I'd like to just take a moment to talk to you a little more about being a student at UCL and talk to you about just where we're going to be located in that experience. So you are going to be very busy. You're going to be doing a lot on this MBA, but there's also going to be just an abundance of opportunities to really engage. UCL is a fantastic university. It's a wonderful place to be a student. And London, of course, is such a grand city to study in. We have an excellent student union at UCL offering clubs and societies. And we hope very much so that our MBA students will create an MBA society to add to that, that can really be part of this vibrant organization and society and support. There's also lots of sports clubs you can get involved in. Volunteering in London is very easy and very needed. So if you want to connect with other students through volunteering, or you want to volunteer with an organization, there's lots of opportunities. We also have excellent student support and well-being team. So they help with mental health and well-being support, and they have a counseling service that's available to our students. Also, the student union also has an advice service. So in addition to the kind of support that you'll get in the Global Business School for Health, UCL is a wonderful place with wonderful services that you can tap into, whether it be having fun, making friends, or if you are having difficulties. They have the services that you can also tap in there to make sure you get the support and care that you need. We really want to look after you and make sure that you have an excellent experience. Now, where will you be learning? The Global Business School of Health is part of UCL's extension, which is the UCL East Campus. It's located in one of the fastest growing parts of London. It's a fantastic, very youthful part of London, and that's in East London. So you can see in the picture there, the two buildings that are towering up there in the back, those are UCL's new campus. And the one on should be on your left has also student accommodations for over 500 students to live on site, in addition to classroom space below. And this part of London is just a fantastic, fun part of London to live in and study in. You will literally be on the former Olympic Park, the Queen Elizabeth Olympic Park, and that is where the buildings are located and many opportunities. So it's an exciting place to live, to be. It sits right next to Westfield Shopping Center, which is the largest shopping center in all of Europe. You've got restaurants, places, cafes. And then you're 8 minutes by train from Stratford to St. Pancras International, which is right in the heart of London and near the Bloomsbury UCL campus. So you feel very connected to everything you do. And then last but not least, there's the incredible sports facilities that are on the park as well. Also, if you've lived in London or if you live in London, London is a fabulous place. It's probably got more parks and greenery than any city in the world. It's full of museums and galleries and institutes and of course pubs and clubs. And it's ranked top city for students in the UK. So it is just full of attractions and opportunities to really engage and have a very fulfilling experience while also studying on the MBA. So that's really all I have to say. I really appreciate you taking the time and hearing about our program. I hope you're as excited as I am. I really believe it is just such a special opportunity for the right students to really progress their career, pivot their career, and make the kinds of changes that will be transformational. And I think you could not pick a more important sector to engage in at a more important time in really the history of mankind. So I hope you'll really reflect. If you've got questions, I'm going to now turn to the Q&A. So please put your questions in, and I look forward to seeing your application come through. Thank you. So I'm going to start now with the questions. So the first question I have open here is, can I get a master's degree through the program in the new school? Yes, you can. And we have got a session coming up for our master's programs. We have 3 master's programs as well as the MBA. We have a master's in global healthcare management that has specialisms in health finance, health analytics, and health leadership. We also have a master's in biotech and pharmaceutical management, and we have a master's in digital health and entrepreneurship. So please look at our website and see when we're going to have that open day. For the IELTS requirement, can it be waived if I've obtained a university or postgraduate degree in the UK? I'm not sure about that, but we'll look into that and come back to you. I think you probably have already taken the IELTS if you've done a postgraduate degree in the UK. So those IELTS scores might be still appropriate. Could you provide some examples of topics and locations for the Global Health Challenge? So locations for the Global Health Challenge, we're looking really at a number of locations. One of them is in Nigeria, in India, in Saudi Arabia, and we'll have a location most likely in Asia. So, and the topics will really depend upon the countries and the locations, but they will deal with things like health innovation, operations, systems, supply chain. They'll very much reflect some of the issues that you'll be grappling with in your course. The reason we haven't specifically listed those yet is that we will be, in the term 2, designing those and agreeing those, and we'll have those up shortly in the next several months on our website. So, yes, is the entry requirement, I assume MB, CHB, the medicine degree is equal to or above a 2-1. It should be, and that classification should be appropriate. And I assume, that's the case, but I again will have us look into that, and we'll add that to our Q&As on our website. For the 3-year work experience requirement, does it have to be health related? No, it doesn't. As I said to you, we're looking for people who are interested not only to extend already what they've done in health, but people who are willing and interested in pivoting into health. So you just need 3 years work experience. It does not have to be in health. What is the mix of formal sit-down examinations and coursework? That's a great question. It's very balanced. We don't have many sit-down exams. Most of it will be coursework, and it's done that way specifically. There'll also be not just your summative formal exams, but there'll be opportunities to work on cases where you'll deliver those orally in your seminars and lectures. Is it possible to have more than one scholarship, women in a developing country? We welcome your application. You can apply for more than one in scholarship. So it is possible to bring scholarships together into kind of a package, as it were. Is there an EMBA? There is not currently an EMBA, but there will be an EMBA, an executive MBA, that will be launched in 23-24. So for 22-23, we are only launching our face-to-face MBA. But the following year, we will have an executive MBA. It will be mostly online. It will have 2 residentials. It's a part-time MBA offered over 2 years. There'll be a residential 1 week in the first year and 1 in the second year. So please look out for that if you're interested in an executive MBA. Is it possible to attend the program from abroad, Switzerland, and do some courses virtually, or is it physical attendance needed? Yes, it is. It does require you to attend in London during those, so you'll have 8 weeks. They're in 4-week blocks. You will have to be there for the 4 weeks. So in term 1, you'll have 8 weeks that you need to be in London. In term 2, you'll need to be 8 weeks. So you could do some of it, but the courses are not virtual. They are face-to-face. You'll have preparatory work that you'll do to prepare for those 4 weeks, but we would expect you to be in London for those 4 weeks when the classes are running. Can you apply for this course without having a GMAT GRE score? You can apply, but we cannot review your application until you take one of those. So you will have to take a GMAT or GRE and have a GMAT or GRE score to actually have your application considered. For clinician doctors, are you looking for senior doctors only, or would you consider junior doctors who have an interest in healthcare management and leadership? I think this program is ideal for junior doctors. This program is designed to be face-to-face. We don't anticipate senior doctors necessarily coming onto this program. We anticipate junior doctors, even possibly trainees or fellows coming onto this program. We would imagine that probably our senior doctors would prefer our executive MBA. So if you are a junior doctor, this is an ideal program for you. If you have worked 10 to 15 years in healthcare business and management roles, such as strategy, commercial, and market access, but do not have a degree, will your application be considered? Absolutely. And I made that quite clear at the beginning, that you need to have a degree, or you can have extensive work experience. 10 to 15 years would be extensive work experience, so you do qualify to apply. Do you expect most applicants to have taken the GRE or GMAT by now to apply for the 2022 admissions? No, we would anticipate that you would take one of those over the next several months, probably preferably the GMAT, and you can get your application in, and then you can submit your GMAT as soon as you have your GMAT completed. So don't feel like you're behind the curve. Applications haven't even opened yet. They'll open up next week. So, but I would urge everyone on this call who's serious about doing this program, and most MBA programs actually require a GMAT. So get your application in to take the exam as soon as possible, and don't hesitate to apply. And then as soon as you've got your GMAT score, report it to us so that we can make a decision on your application. Is it possible to have 2 professional references? Yes, it is. If you don't have an academic reference and you need to and prefer to use 2 professional references. I think the most important thing about references is to make sure that your references are people who know you and can write very comprehensive, clear, references for you and support you in this process. That's much more important. So if you've got 2 professional references that you feel are excellent, definitely I would go for those. How closely is the MBA mapped to the Sustainable Development Goals, climate change, and ESG? That's a really great question. So, of course, those goals are quite comprehensive and made out of many objectives. So we have tried really to bring those in, and where you'll see those come out moreover is just in the quality, the people who will teach on the program, but moreover into some of the topics that we'll have in contemporary topics on health and healthcare. So one of the things that we're exploring is having one of those optional modules be something like health and climate change. So I think that broadly speaking, we haven't specifically mapped, but I think that you'll find through this program, if you look through the content, both in terms of human resource development, the idea that we've really embedded equality, diversity, and inclusion, some of the contemporary topics, and the idea that one of the kind of primer courses that you will take will be specific on global health and the SDGs. Could the funding consist of 2 scholarships? Yes, you can. Ideally, what you should try to do is apply to all the scholarships you can. So look very closely. UCL has a lot of different scholarships. See what you can apply to. So don't hesitate. It's not about having one scholarship. What you should be looking to do is trying to maximize as much funding as you possibly can to put together a package that works for you and allows you to undertake the program. Okay, so I don't see any other questions. Is there any, we still have a few more minutes. I'd be more than happy to answer any other questions, specific to the program, to entry requirements, but also just generally about UCL or the Global Business School for Health. So feel free. I'll just hang on here a couple more minutes. And thank you, Kyle, for joining us. And again, do not hesitate to write us, to reach out to us. We really are excited about this proposition. We want to make sure that we're able to build the right class to give students what they need. And I think anyone who comes onto this program will find it a very special experience, something that will be transformational in terms of their life and going forward. Okay, I have one other question. Can reference letters be co-authored if one has had multiple mentors and managers? I think I would try to avoid getting it too complex. 2 letters of people who really know you will be more than enough. So don't feel like you need to overdo it. I think what I would do if I was you is I'd find, maybe have those 2 people write for you if those are the most appropriate. But also, please remember your personal statement, and I will guarantee you, we will be really taking a very focused look at your complete application, not just at your test scores or your grades. We are trying to put together and build a class here. So your personal statement is very, very important to us, as well as your reference letters. So make sure to spend some time, really put together a very strong personal essay. That's where your mentors, your tutors can come in to help you make sure that it really speaks to us and speaks to you so that we can make a very holistic decision. And that's what I really want everyone on this call to focus on, that this is not just about getting, your English language scores or having the right GPA or grade point average or, classification. This is really about making sure that you can contribute and enjoy, and we can really mentor you into what you want to be going forward. And to do that, we need to look at the application holistically. So I wouldn't worry so much about having co-authored references. I'd get 2 very solid references, but I'd also make sure that my personal statement really reflected the best of me. That's a tough one. Is 2 years experience sufficient for the program? We've said 3 years. So you might want to work 1 more year and come back. If you can put a strong enough argument together that your work experience in its whole constitutes 3 years, we would consider your application. But we're really looking for people with 3 years work experience. Has the UCL East campus been completed or still being developed? The campus the buildings are up. So if you go to East London and you have a chance to go to the Stratford campus, you'll see the buildings. They're not complete. We will have the building that we will start in is called Pole Street East. It will be, complete by the time we start. It's on track. There's no question that it will open up in September. You will be in a very special brand new building. But the skeleton, so if you are in London already, it's fantastic. Just go out there, take a look at the buildings, look at the environment. It's really, really exciting. Okay, so we're down to the last 3 minutes. Again, I'm gonna hang in here. If you can think of anything you'd like to ask or add, please just do that. If not, I'm really excited to have been able to present to you today. I hope that you can appreciate the opportunity. I hope you'll engage with us, and we look forward to your application. Thank you. When is the application deadline? That's a really important question. I'm glad you got that in. We have at UCL what's called rolling admissions. We will close March 31st, but if we draw the class ahead of time, we will close early. So there is a real expectation. My advice to you is in the next couple months to really start your application, try to get it in, because how the rolling applications work is we're going to go through now over the next couple months. We will start to review applications as soon as they're complete. We will then set up the interviews. And then when if we find that an applicant meets the expectations, it's a match, we will make an offer. And once we reach our class size, we will unfortunately might have to close early. So although applications are open, the deadline is March 31st. It's a rolling admissions process. So I suggest that if you're really interested, you try to get your application in before January. Again, Alexandra, thank you. Alexandra, thank you, and thank you for attending. And would the recording of this session be available to review on your website? Yes, we have recorded it specifically for that purpose. So you can go back. And again, if there's things that I haven't answered or questions, please submit them. There's an interest button. You can put those in there and we can come back to you specifically, because I know there were a couple questions that I didn't have full answers for. So we're now at 1 o'clock. I want to say goodbye to all of you. And again, thank you so much for your time and interest in the Global Business School for Health and the MBA in Health. Thank you. Bye.